When preparing to do high velocity techniques, it's first important to do a structural diagnosis to find out what segment is in need of treatment. So the structural exam includes examining the tissues to see areas of tension, bogginess, restriction in motion, any tissue texture changes, and stroking the tissue can bring out a red reflex that shows an area of dysfunction. When an area of dysfunction is identified, then we need the segmental diagnosis. So pressure is placed on the transverse processes to see which way the vertebrae is rotated.
Okay. Erin, can you please go ahead and bend forward?
Then flexion and extension is done to see
Backwards.
the position of ease of the vertebral segment.
Okay. Yes. So T5 is extended, rotated right, side bend right.
Okay, so now we position the patient for treatment.
Go ahead and cross your arms.
The object of HVLA is to have a small thrust that will move the segment only about a 1/16 of an inch. So it's a small distance with a quick thrust. So the hand is placed to rotate the vertebrae left, since it's rotated right. Head is lifted to isolate the segment. Patient takes a breath and lets it out. Then a short, quick thrust is applied.
Okay.
After the treatment, the patient is re-examined to make sure that the treatment is successful. Also, it's important to warm up the tissue prior to doing the treatment, but that usually happens just with the structural exam and the manipulation of the tissues to examine. Okay,
Much better.
successful treatment.